Please welcome the Honorable Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam, and the Honorable Joshua F. Tenorio, Segundo Magalahan Guahan, Lieutenant Governor of Guam, as well as Art San Augustine, Senior Citizen Administrator for the Department of Public Health and Social Services. And now to Governor Leon Guerrero for her opening remarks.
Thank you very much. Thank you very much, Janella. Thank you and for attending this Guam, our press conference. We just wanted to make a little statement and introduce our acting director of public health. Guam has been under a public health emergency now for 120 days. Our public health employees have tirelessly responded to COVID-19 pandemic. They are our nurses conducting the tests at the community outreaches. They are the lab personnel confirming our positive cases. They are the administrative staff processing applications for public assistance. Many of them have not had a proper day off for 120 days. I would first like to say thank you to all the public health employees for what you do for our island. As you all know, Linda Denorcium Pinco retired from public service. I will always be appreciative for Linda for leading public health, not only during COVID-19, but also through the dengue outbreak and the loss of the public health Manila facility. While I am thankful to Deputy Director Lori Duenas for serving as Acting Director, public health needs permanent leadership. That is why I have appointed Art San Augustine as the new Director of Public Health. Art has devoted nearly 3 decades of his life to public health, especially to helping our uncle. He started his career in the Division of Senior Citizens as a social worker and worked his way to Senior Citizens Administration, a position he held since 2007. Art has also served as acting director, acting deputy director, and numerous acting supervisor roles for public health on many occasions. He's very knowledgeable on the inner workings of the agency. He also has a master's degree in human relations and a bachelor's of science in social work. With the help of Deputy Directors Lori Duenas and Josie Mellon, I am confident that under the leadership and experience of Art San Augustine, public health will continue to serve the people of Guam during this pandemic and after. And as he is here today to work, we will hear from Art, or I would like to see. Okay, so I will hear from Art reporting on our COVID status.
Thank you very much, Governor, Lieutenant Governor. Today, our report for July 11 testing, there were 9, and all 9 tested negative. In terms of overall testing for Guam from the period of March 12 to July 13, there has been 17,561 tests conducted. Of that, 10,188 has been performed by the Guam Public Health Laboratory. Of all the tests that has been conducted, 312 have been confirmed cases of COVID-19. Of the 312, 194 are local, 61 are from the U.S. Naval Hospital, 7 cases confirmed by the Guam Memorial Hospital, 42 cases confirmed by DLS, and 8 probable cases for 312. In terms of our medical status, we have 102 in stable status, 3 hospitalized, 202 have been released from isolation, and our number in terms of deaths have remained at 5. In our isolation, we have 34 individuals there. And under quarantine, there are 763 individuals in quarantine as of July 13, 2020, as of this morning's update. 395 are in our quarantine sites, and 368 of the 763 are at home quarantine. And Governor, that's our statistics update as of July 13.
I also just wanted to say that of the 3 that are hospitalized, 2 are GMH and 1 is at the Naval Hospital. Just to clarify that they're not all at GMH.
Thank you, Governor, and thank you, Director San Augustine. And I'd like to also turn it over to Lieutenant Governor Tenorio to make a few remarks.
Yeah, I'd just like to thank Art for taking the leadership of public health, and I look forward to his confirmation at the legislature. I just also want to announce that since Friday evening, more than 30 unsheltered homeless individuals have been provided shelter in a facility in Mighty that was secured by the General Services Agency. We are in a strong partnership with the Catholic Social Services group, and they are providing some shelter management, doing some casework so we can try and understand more the needs. This effort will continue. There is a priority to identify unsheltered families. And so I just say that this is first in a few of a series of efforts in trying to have a comprehensive approach to dealing with the homeless individuals. For the ones that were unsheltered, that are sheltered now, these individuals, we are sheltering them and protecting them from any community spread from COVID, and we'll continue that effort.
And as a reminder, Lieutenant Governor, we do have that Zoom meeting this coming Thursday.
Right, that will be a first meeting of the Interagency Council on Homelessness.
Thank you, Lieutenant Governor Tenorio. We'll now open the floor to questions from the media. We'll begin with the Guam Daily Post. Heidi Gilbert.
Good afternoon, Governor. Is Gov Guam considering testing at the airport, and do we have a tourism reopening date?
We have some very preliminary discussions about testing at the airport because there are a lot of logistics that we have to consider. So right now, there's no decisions made to test at the airport. There is no decision on a reopening date for tourism.
And my follow-up question is, what is the threshold for returning to normal? How many COVID cases should we stay under, and for how many days before we go back to PCOR 4?
So PCOR 4 is going to be a real big challenge because our criteria for PCOR 4 is that vaccinations and vaccines are going to be available. So that is going to be a bit of a wait. As you probably follow, there have been several studies being made. There are clinical trials out there being made all over the world for vaccination. There's hundreds of millions that are being, I think, projected to be distributed, but I don't know when. So there's really no I don't know if we can say, Heidi, that we'll ever return to normal, or that we can say that there will never be a coronavirus infection here, because we are, as experts and as the scientists really understand, this coronavirus is going to be with us for a long, long time, if not forever. And so that's why they are looking very expeditiously to provide the vaccine that's needed. That's when we will probably be at our PCOR 4.
Thank you, Heidi. Next is I-94, Thomas Manglotnia.
Good day, everyone. My first question is for the new director. Director, do we have any update on the GPD and DOC contact tracing?
Thank you. In terms of the GPD and the DOC contact tracing, I haven't been briefed on that at this point, but this afternoon, I'm sure I'll be briefed on that and provide updates at a later time.
All right, and my follow-up is for Lieutenant Governor. Lieutenant Governor Tenorio, are you able to provide more details on the Interagency Council and who is a part of this council and what might be the first on the agenda at the first meeting?
Sure. Maybe I'd refer to you to a previous press release in maybe last week, that an executive order that the governor enacted basically revamped the Interagency Council that was once created by Governor Felix Camacho. And so the new members of the Interagency Council, I will be the chair. The vice chair is Mayor Robert Hoffman. and the president of Guam Housing Corporation, executive director of the Guam Housing and Urban Renewal Authority, and the manager of GRTA are on that, along with 2 people that are appointed by the governor. Those 2 people, well, I'll let you know on Thursday, because I believe those appointments are being made today. But there are 7 of us. All the other agencies in the government are going to be providing technical support and coordination. And the first mission of the council, we will review the mandate that we have. We'll get an update on our efforts to provide shelter to COVID, shelter from community transmission of COVID. And then, of course, we have efforts to deal with long-term and transitional housing options for all of these people.
Thank you, Thomas. Next is PDN, Jarek Sablon.
Hi, can you, and I guess Governor, Lieutenant Governor, can you provide, I guess, a little bit more detail about the homeless contract, I guess you guys recently gave?
So the details I can give you are that the Civil Defense made the request. We gave resources for Civil Defense to identify with GSA's help options to provide non-congregate shelter for unsheltered homeless folks. And so there is a hotel motel facility in Mighty that submitted, that was identified through the emergency procurement process by GSA. That contract was issued, and on Friday night, the first family, unsheltered family, was given the shelter. We have also contracted with Catholic Social Services to provide shelter management and wraparound services to the folks that we are providing shelter to. There is an effort throughout the government to identify unsheltered individuals. Many of them have been residing in public parks for priority for shelter.
And so, Lieutenant Governor, how many people, I guess, are you guys allowed to house under the contract? Is it just the 30, or is there going to be more?
Well, I think we have 40 rooms that are available, and assignment of the rooms are done based on screening by Catholic Social Services. But like I said, this first effort is to provide some non-congregate shelter for homeless individuals and families to protect them from community spread of COVID. And our interagency council will be working diligently on the next steps to further the shelter program.
Thank you, Jarek. Next is Mariana's Business Journal, Maureen Maritita.
Buenas, I hope you can hear me. Good afternoon, everybody. Governor, you said earlier that there's no decision on a reopening date yet. I'd like to ask why not? Because previously you've had tentative dates and tentative targets. And I think last week you were also saying there was no decision on a reopening date. And I think people would like to feel encouraged that it is still top of mind with you. So could you please comment?
Yes. First, I'd like to say, Maureen, that travel really into our island has never really been ended. People have always been allowed to travel into our island, and we continue to do that. Because of the pandemic, of course, we are restricting or having some restrictions on how their activities are when they come on island, because we need to protect our people and we need to make sure that we monitor them for coronavirus. The dates has not, we discussed this with the GVB, and really no decision on the dates have been made because we have not yet decided on when exactly we will have to redo our protocols to allow for more travelers to come in. Additionally, we also are still looking at our science and our data in making sure that we are very confident in controlling our virus, and also in making sure that we protect our public health and public safety. So even together with GVB and the industry, we have not, if a date is what you need, there has not been a date made.
Okay, thank
so
you.
I guess my advice to the industry, which I have already, I have discussed, is prepare. Always be prepared. Even when we were talking with the airlines to schedule them, because eventually we will be lifting some restrictions, and we will be looking at what is the best protocol that would be a balance between the economy and also our public safety.
Okay, to follow up, a two-part question. So if you were a betting woman, would you expect that we would see tourists coming back in September or October? And also, do you have any update on talk of movie theaters and other businesses reopening?
So first of all, I am not a betting woman. When I make my decisions, Maureen, it's very much based on a confidence that I have that I will win. So in terms of tourism coming back, I will tell you that I don't think we will have complete return of our tourism for the next year, 2 years. And this is the reason. The reason is these countries also are just as concerned about this coronavirus, that they're not even allowing their returning residents to just come back. They are requiring PCR testing when they come back, and they are requiring quarantine when they come back. So I think till these countries also lift their restrictions, I don't think there's going to be much traveling back and forth. So I would say that if we are going to start seeing, if at all we are going to start seeing tourists, I will say not till like the first quarter of next year. And maybe only very limited amounts. And again, Maureen, that's very dependent on how these countries look at us. We are part of the U.S. And as you know, the U.S. right now is in hot spots all over. And they are lumping us in together with the U.S. So we are to them, a very high risk, high spot area. And until I think the U.S. also stabilizes their virus, that would be very difficult for the tourists to come. What was your other part of your question?
I was asking about the movie theaters and any
other
movie
theaters. Yes, we are looking at that. We are going to be making an announcement Monday. They are allowed already to be open. Sorry, I think we already gave public health the go to allow them to be open. As far as other businesses, I can't. Bingo is another one. That one we have not yet lifted its restrictions. And if you realize that that is because they're very high risk congregate areas, and the people that do go to bingo are our most vulnerable members of our society. And I'm very nervous about making sure that we protect our manamku and making sure that they, that we have the preventive measures to secure their health and safety.
All right. Thank you, ma'am.
Thank you, Maureen.
Thank you, Maureen. KUAM, Nestor Lecanto.
Thank you. Good afternoon, Governor, Lieutenant Governor, and congratulations, Art, I think. Governor, you said that it's not likely that tourism is going to
And so that I think is an industry that would help us with our economy, and move on in that way. Plus, also still very much support and encourage the bringing back of our tourism. We have expended, as we always have, a lot of investment and resources to make sure that our tourism is maintained and our tourism continues and our tourism comes back with greater strength and a good rebound.
And how about attracting businesses, for example, from Hong Kong, which I understand that there may be some exodus from that because of the problems they're having. And also, you didn't talk about austerity or cost-cutting measures.
So what we have actually been in contact with some people that would help us make inroads to the Hong Kong investment. And we'll be doing more of that, Nestor. In terms of austerity, I have always said that our government has been the most frugal administration since the last 8 years. Our budget is not overinflated. Our budget is very real. It's very realistic. Austerity programs, anywhere from improving our technology so we can be more efficient and effective. Austerity programs might be also to look at alternative energies that we might be using to help run the operations of our government. Austerity programs, of course, is to hire the right people in place. And so those are some of the things that we are looking forward into providing more wise and better use of the limited financial resources that we have.
Thank you, Nestor. Pacific Island Times, Johanna Salinas.
Off a day, Governor, Lieutenant Governor. Congratulations, Mr. Arthur. Hi. So my question is what exactly is the administration doing to diversify Guam's economy?
Okay, so one of the things that we have been making also a priority is in the areas of agriculture and aquaculture is one of the priorities that we're looking at. And again, we are trying to find ways where we can use various options so that we can attract people for maybe financial services. Telecommunications is another one. Data warehousing is another one that we're looking at. We're also working in ways that we can do green recycling, green programs, so that it can create jobs. There's many options that we are in the process of discussing, not just discussing with the Guam Economic Development Authority and so forth.
Okay, so my next question is, when do you think we'll be able to have that island-wide cleanup that has been postponed?
Oh, okay.
Well, you know what? I would tell you that if things look better, things are looking better. We've managed to really contain the spread of COVID. And so I would just telegraph that as soon as perhaps we move into the next condition of readiness, then we'll be scheduling something with GVB.
Okay, thank you.
Thank you, Johanna. PNC, Kevin Kerrigan.
Good afternoon, everyone. I'd like to ask the governor, last week at the GVB board meeting, GVB President Gutierrez said something that was pretty provocative. He said, the governor of Guam has to be pressed continuously about the importance of opening up Guam and the businesses on Guam, because other things could happen that are more dire than getting COVID. He said, I know that lives can be lost, but still there might be more lives lost if we don't build up our economy. What's your reaction to that comment, Governor?
I think for me, Kevin, and I think for the people of Guam, we need to prioritize that our lives have to be the main priority and the health of our community be the main priority. We don't have people's health. If we don't have people living in a life, we can't move on in any kind of economy or any kind of living alternatives or living opportunities here in our island. I think the economic health of our island is also just as critical. And with the economic health of our island, we have to make sure that when we do start totally opening our island and lifting restrictions, that we do it in a very methodical, very safe, very slow way. We only have to look to the United States in those states that have opened all at once without any kind of gradual lifting and monitoring and data testing. Experts like Dr. Fauci is out there saying that when we do open, make sure we open gradually and make sure that we monitor, make sure that we test, make sure that we do contact tracing, make sure that we have hospital capabilities that are able then to provide the healthcare that we need should we have a surge. So those are the kinds of things that we need to be very cognizant and be a priority of. And I think if we do not protect our health, if we do not protect the lives of our people, there's no sense in any economy at all. And so my look as governor and as a leader trying to lead our people through this crisis, not just a health crisis, but also an economic crisis, is has to be very diligent, has to be very deliberate, has to be making sure that we consider all possibilities and we can anticipate all possibilities so we can put in the actions and the decisions that we need to address these challenges. And so a balance there is the health of our people and the health of our economy, and not just opening tourism to just open tourism is not the right way. I think if we decide to invite more travelers to our island, we need to make sure that they also feel like they're coming to a safe place. And we have to make sure also that they are coming from a safe place to our place. And what can we do to make sure that when they are here, that we continue to protect our island safety? A lot of logistics, a lot of thinking, a lot of strategic, a lot of complex discussions, a lot of deliberate, thoughtful, scientific information, expertise, advice, and so forth have been and continue to be made, Kevin, so that we can make sure that what we're doing is the right thing. And I have to say that what we're doing is the right thing, because we're continuing to contain our virus and we're continuing to increase mobility of our people. And as we become more active in the community, as we go out more often, as we become more open to more contact with people, our exposure increases, but our virus continues to be contained. And why is that? Because we are monitoring, we are testing, and we're doing contact tracing, and we are doing it slowly in a very, like I said, methodical, scientific, strategic way.
Thank you, Governor. And as a follow-up, Attorney General Camacho last week raised some concerns about what he believes to be the disparity between the quarantine requirements and restrictions for the military and on the civilian side. He said quarantining standards should be equalized on both sides of the fence. Have you reached kind of agreement with the military on that?
Right. And I think it's a matter of update and more information that the Attorney General needs to have. And their quarantine, the military's quarantine, is basically following our quarantine protocol. We have had several meetings, Kevin, not just with the military leaders, but also with their public health people, our public health people. I talk to Admiral Manoni almost every day concerning events happening with the coronavirus. And so their quarantine guidelines are in alignment with our quarantine guidelines. In fact, when they do the quarantine, they have used our protocol and they have used our guidelines. And he advises me almost every day about updates. And they, like we do in our quarantine facilities, Kevin, they also have security that makes sure that things are being complied with. They do not have contact with any of the community. They do medical evaluations twice a day, like we do. They monitor the airmen or the servicemen or the military personnel on the symptoms of COVID, like we do. And so they follow our lead. I do know that the military looks to us as guidance and they follow our lead.
Thank you, Governor.
Thank you, Kevin. The point, John O'Connor.
Thank you, Governor. About $6.4 million in child care and development block grant funding was received by GovGuam a few months ago. As we understand, only about $830,000 of this has been awarded. My understanding is public health is engaging with the AG on guidance for it, but AG review and approval is not necessary. Can Art discuss why it's taking some time to distribute these grant fundings to childcare facilities?
Well, let me share a couple of things. First and foremost, I do want to share that I am calling a discussion meeting tomorrow with the manager of this program to get a succinct picture as to the situation. But what I was shared with today is this, is that there's a process, and the process doesn't allow these funds to be used to pay for those child care who have used the payment protection program. So these funds are only available to child care facilities who've exhausted those funds, and they need to be in that category. But we will be providing more information. I'm meeting with their division head, who was interviewed recently on the media, Task Archangel, and she will be providing me an update on the situation of the $6.4 million that we received and the $800,000 that has been paid so far. She did share that there are 9,030 applications that affect 19,377 households. And so we'll be reviewing that tomorrow morning. And that's all I have at this time on that. Thank you.
Okay, Mr. Art. Shifting away from that, the opening of public schools has been a topic in national media. We're still about a month away from GDOA's start date, but as I understand, Governor, you would have to authorize the opening of schools. So what kind of situation do you foresee where you would be able to allow for the opening of schools? And conversely, what kind of situation do you see where you would maintain that schools stay closed, even moving into the next school year?
So we would continue to use the criteria and the guidelines that we have always used in the past in lifting restrictions, and that is making sure that our coronavirus is contained, making sure that we have the capacity for the contact tracing, making sure that we have good hospital capacity. And right now, over the last, I would say, a couple of months, we have only had a census of COVID patients of about maybe 2 to 3, which is good. And of course, our ability to test and test and test. And so all those criterias we continue to meet and satisfy. We have been, and I will ask the Lieutenant Governor to give more update, because he's been the one really very in close contact with Superintendent John Fernandez. But I know that Public Health is also working very closely with DOE and the schools to approve the guidelines that they are going to be submitting. I do know that we are requiring a minimum requirement of face cloth covering, a minimum requirement of social distancing, and a minimum requirement of hygiene and sanitation. And as they look at these minimum requirements, the schools can either add and supplement. And I know that the schools are very complex. We have to think about bus operations. We have to think about logistics. We have to think about what's the best way to social distance. But please be assured that there is very close communications with the superintendent and also the superintendent for the private schools. So I'll ask Lieutenant Governor to give some more update.
Thank you, Governor. And let me just add that the Guam public school system over the last period of months has been developing some guidelines for all of their 42 schools, primarily based on guidelines that have been issued by CDC. There is a technical group that is helping in the school program, and that is a subcommittee in the Physicians Advisory Group that is focused on education, led by Dr. Michael who is one of our island's pediatricians. So what I can expect is that Public Health will issue some minimum criteria that these schools, many of them already have some plans, would just make sure that they meet the minimum criteria, and it'll be up to their school governance structures to see if they depart from the criteria upwards. So we will be issuing a floor, and the schools communities will be able to set their own ceilings based on their own situation. So some of the leading factors are going to be occupancy of the buildings and whether or not there are other structures on school campuses that can be put online so that they can comply with the social distancing mandates. In a few days, we'll have a consultation session that will be scheduled, and that will be focused on the charter schools and the private schools. And we'll have the Physicians Advisory Group conducting that along with Public Health to talk about some of the draft criteria and to really get an offer to or use the opportunity to consult with the school communities on what that means. The other thing is school bus operations. And so we've already started our planning for school bus operations. Again, Public Health is looking at some minimum occupancy requirements for school busing. And we'll be working with Civil Defense to try and make available some potential resources to supplement Public Works school bus operations to see to it that our system is responsive to the needs of all of the Guam's kids, so Guam students. So that's sort of the path right now. I know that people are scrambling because school's coming up, but I just want to reemphasize that the decision to open school and these parameters are based on the public health situation and requirements of our island. And we just look forward to continue the partnership and try and address the parents' concerns. I'd also point to some of the data that the superintendent has provided us. Part of this will be decisions at the home front on whether or not they're going to allow their kids or they're comfortable with their kids for face-to-face instruction. And the other thing is we have some federal funding opportunities that will be pushed out over the next weeks and months to try and help bridge access to the internet for all of the school children and students that will either in whole or in part require distance education to supplement their education plan.
Thank you, John. Thank you, Lieutenant Governor. Governor, closing remarks.
Yes, thank you very much, Janella. I'd just like to thank again Art St. Augustine for stepping up to the task and leading our public health team forward to, again, continue and sustain the public health and the safety of our community. Also like to thank the Lieutenant Governor for his very aggressive work, I think, in the shelter, high-risk shelter and the homeless situation, and also for making this happen. This is a situation that I think even previous administration has been working to make it happen. And I'm very proud that our Lieutenant Governor has made it happen, along with some really good team players, the mayors, the Department of Public Works, Department of Parks and Rec, Catholic Social Service, the Homeless Coalition, and I think our executive order to revitalize the Interagency Council, I think, is right on. And you'll see that when we say that we are going to do what we're going to do, that it will be done. I also want to thank the Lieutenant Governor for his very close communication with the Department of Education and the work in making sure that whatever guidelines we put forward will be as a result of our goal in protecting our students, our employees, and our community. And I also want to thank the people of Guam for their patience and their understanding and this great struggle that we are continuing to have. Again, we're not yet out of the woods. We, as you see, we have very active cases still here, but do appreciate that you comply with the directives that we have set forth. And I know 120 days is a long, long time, but I think we will have to continue on more and longer to make sure that we are all safe. So again, thank you. And I appreciate your patience. I appreciate your cooperation. Sizuzmasi.